Arteries don't suddenly fail. They quietly narrow year after year, while most people feel completely fine. That's why heart attacks and strokes often seem to come out of nowhere. But they don't. The body sends warnings long before the crisis, signals most people overlook or ignore. If you know what to watch for, you can catch trouble early and change the outcome. Blocked arteries form slowly as cholesterol, fatty plaque, and inflammation build up inside the vessel walls. As the space for blood flow shrinks, oxygen delivery drops and pressure on the heart increases. This process raises the risk of heart attacks, strokes, and long-term cardiovascular damage. Even though it happens gradually, your body often alerts you along the way. These signs are usually subtle, easy to explain away, and commonly dismissed. Learning to recognize them early gives you a powerful advantage. It allows you to act before a life-threatening emergency occurs. Here are 12 warning signs that may signal blocked arteries and should never be ignored. 1. Chest discomfort. Chest discomfort is one of the most recognizable signs of artery blockage, but it doesn't always feel dramatic. It may show up as pressure, tightness, heaviness, squeezing, or a burning sensation that feels like indigestion. This happens when narrowed coronary arteries limit oxygen-rich blood to the heart muscle. The discomfort often appears during physical effort or emotional stress and improves with rest. As blockages progress, the pain may happen more often, last longer, and even occur at rest. This condition, called angina, is a serious warning that the heart is under strain. Because it's easy to mistake for heartburn or muscle pain, many people delay getting help. Chest pain that returns, worsens, or lasts more than a few minutes should always be checked, as waiting increases the risk of a heart attack. 2. Shortness of breath. If everyday activities suddenly leave you breathless, your heart may be struggling. When arteries are narrowed, the heart must work harder to pump blood through the body. Over time, this can lead to fluid buildup in the lungs, making breathing more difficult. You might notice shortness of breath while walking, climbing stairs, or even lying down. It may also come with chest tightness, weakness, or sudden exhaustion. Many people assume they're out of shape or just getting older, but unexplained or worsening breathlessness is not normal. When this symptom appears without a clear cause or keeps progressing, it's a strong signal that your heart needs attention. 3. Pain in the arms, neck, jaw, or back. Heart-related pain doesn't always stay in the chest. Blocked arteries can cause discomfort that spreads to the left arm, shoulder, neck, jaw, or upper back. This pain can feel aching, sharp, tight, or radiating and may come and go. It often worsens with activity and improves with rest, a key clue that blood flow is limited. Women experience these symptoms more often than men and frequently mistake them for joint pain, muscle strain, or stress. Because chest pain may be absent, this warning sign is especially dangerous. Ongoing or exertion-related pain in these areas should always be evaluated. 4. Leg pain and cramps. Pain, cramping, heaviness, or numbness in the legs during walking may be a sign of peripheral artery disease, or PAD. This condition develops when plaque narrows the arteries supplying the legs, reducing oxygen to the muscles. The discomfort usually improves with rest, but returns when movement resumes. As circulation worsens, pain may occur even while resting. Many people assume it's just aging or muscle fatigue, delaying treatment. Additional signs include cold feet, pale skin, weak pulses, or sores that heal slowly. Left untreated, PAD can lead to serious complications, including infections and limb damage. 5. Erectile dysfunction. Ongoing erectile dysfunction can be one of the earliest signs of poor circulation. Healthy erections depend on strong blood flow, and narrowed arteries reduce circulation throughout the body, including to the penis. While many men blame aging or stress, research shows erectile dysfunction is often linked to cardiovascular disease and can appear years before more obvious heart symptoms. Ignoring this signal allows artery disease to progress silently. Improving blood flow through physical activity, nutrition, and cholesterol management can reduce risk and support overall vascular health. 6. Dizziness or lightheadedness. Frequent dizziness, feeling faint, or sudden lightheadedness may indicate that blood flow to the brain is reduced. This symptom is often blamed on dehydration or low blood sugar, but restricted arteries are a common cause. Narrowed vessels force the heart to work harder and can lead to sudden drops in blood pressure, especially when standing up. Episodes may include blurred vision or confusion. When dizziness happens repeatedly or without an obvious reason, it should not be ignored, as poor brain circulation raises the risk of stroke. 7. Ongoing fatigue and weakness. Persistent exhaustion that doesn't improve with rest can be an early sign of circulation problems. When arteries are blocked, muscles and organs receive less oxygen, leaving you drained. Everyday activities may suddenly feel overwhelming. This type of fatigue often worsens gradually and is especially common in women as an early sign of heart disease. It may also appear alongside shortness of breath or chest discomfort. Because fatigue is easy to blame on stress or poor sleep, it's frequently overlooked, but persistent unexplained tiredness deserves attention. 8. Blood pressure that stays high. Narrowed arteries force blood through smaller openings, raising blood pressure. If blood pressure remains high despite medication or lifestyle changes, blocked arteries may be contributing. Over time, uncontrolled pressure damages blood vessels and increases the risk of heart attack, stroke, kidney disease, and vision problems. Many people feel no symptoms at all, which is why regular monitoring is essential. Addressing cholesterol, reducing sodium, staying active, and maintaining a healthy weight can help reduce strain on the heart. 9. Swelling in the feet and ankles. Swelling in the lower legs, ankles, or feet can signal that the heart isn't pumping efficiently. When circulation slows, fluid can build up in the lower body due to increased pressure in the veins. This swelling often worsens after sitting or standing for long periods and may cause shoes to feel tight. Persistent swelling, especially when paired with shortness of breath, should be evaluated promptly. Managing salt intake, elevating the legs, and staying active can help reduce mild swelling. 10. Wounds that heal slowly. Poor circulation slows the body's ability to repair itself. Cuts, blisters, or sores on the feet that linger for weeks may indicate restricted blood flow. Without enough oxygen and nutrients, healing is delayed and infection risk rises. This is particularly dangerous for people with diabetes. Left untreated, wounds can worsen and lead to serious tissue damage. Regular foot checks and prompt medical care are critical when healing is slow. 11. Skin color or temperature changes. Unusual skin color such as pale, bluish, or reddish tones in the legs, toes, fingers, or feet can signal poor circulation. Affected areas may feel colder than the rest of the body. Skin may appear shiny, thin, and hair growth may slow or stop. As circulation declines further, numbness or tingling can develop. Severe cases can lead to ulcers or tissue damage. Maintaining movement, avoiding smoking, and following a heart-healthy diet support better blood flow. 12 mini-strokes. Sudden trouble speaking, temporary vision loss, facial drooping, or weakness on one side of the body may indicate a transient ischemic attack, often called a mini-stroke. These events occur when blood flow to the brain is briefly interrupted. Symptoms may disappear quickly, but they are a serious warning that a major stroke could be next. Confusion, dizziness, or loss of coordination may also occur. Mini-strokes should always be treated as emergencies because early action can prevent permanent brain damage. Blocked arteries don't usually show up with sudden dramatic symptoms. More often, they develop quietly while the body sends small warning signals that are easy to overlook. The key is catching those signals early before they turn into a heart attack, stroke, or permanent damage. If any of these symptoms sound familiar, don't ignore them or wait for them to worsen. Getting checked early can make all the difference. Your arteries are the lifelines that fuel every organ in your body, and protecting them means protecting your future. Listen to your body, act early, and take control of your heart health, because prevention today is far more powerful than treatment tomorrow.